to Medical Dialogues. I'm Roshnida. Let's look at today's top medical news. LGB survivors of adolescent and young adult cancers have underlying chronic health conditions. Studies have indicated that minorities, sexual orientation, and gender identity populations have higher prevalence rates of many chronic conditions, including heart disease, stroke, hypertension, diabetes, lung disease, and kidney disease, than heterosexual populations. Lesbian, gay, and bisexual adolescents and young adult cancer survivors in the US are more likely to report experiencing chronic health conditions than their heterosexual peers with a history of cancer, as well as their LGB peers without a past cancer diagnosis. The findings come from a survey-based study published by Wiley online in Cancer Journal. To assess the burden of chronic health conditions among survivors of adolescent and young adult cancer with minoritized sexual orientations, a team led by Michael E. Roth, MD of the University of Texas, MD Anderson Cancer Center, analyzed data from 2013 to 2020 from the National Health Interview Survey. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. The team's analysis included information on 170 LGB cancer survivors who were matched by 1,700 LGB individuals without a history of cancer and 1,700 heterosexual cancer survivors. LGB cancer survivors were more likely than LGB individuals without a history of cancer and heterosexual cancer survivors to report at least one chronic health condition and more than two chronic health conditions. These elevated risks were seen for conditions including cardiovascular disease, arthritis, and pulmonary disease. After adjusting for socio-demographic variables, LGB cancer survivors had 2.45 times higher odds of having chronic health conditions than LGB individuals without a history of cancer and 2.16 times higher odds than heterosexual survivors. The researchers said that the study highlights significant health disparities that affect the LGB cancer survivor community and points to the need for specialized care and attention for these individuals during and after their cancer treatment to address their heightened risk of chronic health issues. Researchers also said that this could hopefully lead to more equitable health care for sexual and gender minority populations. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.